The universal health care has been hailed as a holy grail of Canadian society. Many of the health reports published paint this publicly funded health system as a reflection of their core values. Such conclusions are easily made basing on the surveys that put Canadian satisfaction rate with the health system at 85%. There are, however, several problems with universal health care in Canada that have persisted over time. The publicly funded health system is facing major challenges that threaten to render it unsustainable in the long run. The major areas of concerns include the patient average wait time, the shortage of professional medical personnel, and the increasing challenges of funding. The average time a patient will wait for a doctor is very long, as indicated by 59% of respondents in one survey, who reveals that they take an average of 4 weeks before they can get to see the doctor. This situation is particularly common among those patients seeking specialized treatments in areas of sight restoration, diagnostic imaging, scan, cardiac surgery, and joint replacement. The challenge is particularly worse when it comes to diseases that are classified as acute and requires specialized attention. Heart diseases, cancer, joint replacement, sight restoration, and diagnostic imaging are some of the areas where Canada scores poorly in terms of waiting period before seeing a doctor. The concern forced the government to develop a plan to address the issue in provincial hospitals by reducing wait time, particularly in the areas of cancer, heart diseases, diagnostic imaging, sight restoration, and joint replacement. The plan was enrolled in 2005, but the latest surveys still indicate waiting time as their number one concern. This is persistent in the areas of specialized surgery and elective surgery, where this country continues to score poorly. Canadian nurses, on the other hand, have their issues. They have put forward a demand that the number of nurses be increased. In addition to this, improvement in the quality of education and expansion to their working scope also falls into the list of their concerns. Given the pivotal role these nurses play in health sector, their demands cannot be ignored. Nurses, on the other hand, have continuously expressed their dissatisfaction as they want the number of nurses significantly increased. Improvement in nursing education and maximization of the scope of nursing practice also form parts of their demands. Such shortages in numbers of doctors and nurses only increases the wait time in public hospitals. The government directs a huge portion of the budget into funding of the public health care. The strain has seen the national insurance failing to cover some supplemental benefits, such as dental care. This means that the patients have to turn to private sources for treatments in such areas. Despite these shortcomings, many Canadians still value their health system very much and would prefer that the problems with universal health care in Canada are addressed rather than the whole system being shut down. Those in favor of the radical measures in correcting the system are still the majority, according to a poll conducted in 2007 by Queen's University, Kingston, Ontario.